So the last thing that we want to talk about is vaccines. Again, this is a very broad topic that I won't spend too much time on, but the normal birth vaccines, a BCG and a hepatitis B, these are not legally required in Singapore, so it's your option. And it's one of those things to talk with your doctor about what you want to do for vaccines. Obviously, vaccines are safe. We always recommend them for everyone. They have tremendously reduced a lot of suffering, a lot of illnesses, a lot of deaths that we used to see in children because of the effectiveness of vaccines. But the right schedule for you is the right schedule for you. It's something where people have very different opinions. Some people like to limit vaccines. Others would get every vaccine possible. And again, it's your preference as a parent and making sure you discuss the benefits and the risks of what you want to do with your doctor. There is now, and this is the old Singapore schedule. It's recently changed, but it's pretty similar. This hepatitis B is one that most doctors are not doing now because it's not necessary, and it can be done as part of this, the 6-in-1, which is Hep B, DTP, polio, and HIV. So because we can do a combination vaccine at 2 or 3 months, a lot of doctors are not doing the separate hepatitis B. It does reduce the number of pokes that your baby has to get, so it's something where, in general, there's very few reasons to do a separate Hep B anymore. Also, as you get older, the MMR at 12 months, we also have an MMR plus chickenpox. This is one not mandated in Singapore, but it's a very good vaccine to get. Chickenpox is usually not a dangerous illness, but it's not fun to get, so you can prevent it. Most all of us as doctors would say it's a good idea that you could do in combination with the MMR, so it's not an extra injection, and it's something that is good for all babies. And it's starting to be recommended now on the Singapore schedule to do chickenpox after age 1. Again, there are plenty of other optional vaccines. Rotavirus prevents a vomiting and diarrheal illness that can be very severe. It's one of the more common causes of hospitalization because you can vomit for a week or two with this. Diarrhea, you get dehydrated and you need fluids in the hospital. This is a very safe vaccine, either 2 or 3 doses depending on the brand, and it can prevent the chance of getting rotavirus. So especially if you're in daycare, if you have big brother, big sister bringing viruses home, rotavirus is a very good thing to get. Like I mentioned, chickenpox, it is not something we expect to be dangerous, but it is a good vaccine. The biggest benefit probably is it lowers your risk of shingles. So that is something that's miserable to get, and if you get the chickenpox vaccine, that's lower. Hepatitis A is a travel vaccine everyone should eventually get in Singapore because it's a very common viral illness found throughout Southeast Asia. Meningococcal is one not done in Singapore because there's effectively no meningococcal disease in Southeast Asia. But if you are on a schedule that's European, Australian, if you expect to be moving there or living there or spending a large amount of time there, meningococcal vaccines are very important. Again, something to talk to your doctor about the risks and benefits and whether it makes sense for you to get this. Generally, these are not done in the first few months, but they can be done at any time after roughly 2 to 3 months or after age 1. So where do you get your vaccines? There's, of course, 2 choices in Singapore, the polyclinics and a private clinic. There is no doubt a polyclinic is going to be cheaper. Whether you get the vaccines for free or whether you get it at a reduced cost, it is going to cost less money almost always to get these vaccines in a polyclinic. The negatives can be they're crowded, they're slow, a longer wait, and a lot of times you don't get as much of a developmental check, you don't get as deep a discussion about your questions, your worries, the problems, if you go to a private clinic. Private clinics are great, definitely the vaccines are going to cost more, and a lot of times you're going to get more of a chance to talk about the sounds your baby's making, the development, the sleep, all the little issues that really should be talked about at every visit. And for payment, baby bonus and MediSave, so that wherever you get your vaccines, you can reduce the costs, so that you can afford the vaccines that your child needs and that you can get in a way that doesn't put as much pressure on you financially.